So delay allergic reaction. It is caused by memory T cells. What happened is that, an example is the TB test, TB skin test. So what happened is that after the TB skin test, the skin become red and hardened. It is positive. It tells you that, oh, you have previous exposure to TB. The memory T cell will react to the TB skin test and causes this reaction. So blood type reaction. We talk about blood type when we go through the genetics. Yeah, the genetics. So I will go through these few slides really quickly. So we have A, B, O types, and because we have the antibodies in the blood. If you are type A blood person, you have the antibody B in your plasma. If you are type B blood, if your blood is type B, then you have antibody A in your plasma. If you are type AB blood, then you have no antibody in your blood plasma. If you are type O blood, then you have both antibody A and antibody B in your plasma. So it is this table. We talk about this in the genetics. Transfusion, we also talk about the compatibility of the blood. So the term is called agglutination. Agglutination meaning that the antibody in the plasma will bind to the blood cell, and then because of that, because of binding of the antibody on the blood cell, it will clump those blood cells together, forming like a blood clot. So type O is universal donor, type AB is universal recipient. So if the blood transfusion is matched, that means type A blood donor receive, let's say type A blood, then it has the antibody B there, and so there's no binding, then the blood looks like this. On the other hand, if the transfusion does not match and you have agglutination, the antibody will bind the antigen expressed on the blood cell, and then you will clump the blood cell together. You will form this kind of, you can call it a blood clot. So Rh factor is something that I would like to talk about as well. We have Rh positive and Rh negative. So first of all, before we talk about that, so whether or not a person is positive or negative, it follows the Mendelian genetics. So it is inherited. So Rh positive is the dominant trait. It's a dominant trait. That means the antigen is present in the red blood cell. 85% of the US population are positive. That means most of us here. Rh negative, meaning that the red blood cells do not have the Rh antigen. Only 15% of the population. So what would be the issue? Normally we do not have antibody against the Rh factor, but it is when during the pregnancy that causes the issue. So the issue is when the mother is Rh negative, but the baby is Rh positive. That is the issue. So, for example, if the father is Rh positive, but the mother is Rh negative, so according to the Mendelian genetic, you can basically do it quickly in your head. You know that the baby will be Rh positive. Will have a chance to be Rh positive. So if the baby becomes Rh positive, carried by the Rh negative mother, what will happen? There's a placenta, you know the placenta. Theoretically, the function of placenta is to separate the blood of the mother and the blood of the baby so that they do not mix, theoretically. Practically, the placenta is not perfect. some of the baby cell can go into mother's stream. When the mother detects some of the baby cell, then the mother will start to make the anti-Rh antibodies. The reason is that mother is Rh negative, but the baby is Rh positive. So the mother does not recognize the baby's blood, the Rh positive blood. So the mother considers it as foreign. Then the mother will start to secrete the antibody, to make antibody to attack those Rh positive blood tissues in her body. So, but the first time when the woman gets pregnant is okay. The reason is that it is this reason. So instead of first exposure to vaccine, you may call it a first pregnancy. When it is first pregnancy, the mother will secrete a low level of the antibody to attack the Rh positive blood from the baby in the mother's body. The low level of antibody will not be strong enough, will not be strong enough to cross the placenta to affect the baby. That's why the firstborn will survive. But subsequent pregnancy will trigger the secondary response, which is you will have a mother will secrete a lot of antibody and it will last for a long time. Because of the high titer of the antibody secreted by the mother, all this antibody will be able to diffuse across the placenta to attack the baby. And the baby, in minor case, it can cause mental retardation. In a serious case, it can actually kill the baby. So it is actually the active immunity, active immune response that causes this issue. So causing the hemolytic disease of the newborn. How do we treat it? Very simple. We inject the antibody, the anti-Rh and immunoglobulin, the antibody that against the Rh positive, into the mother. So we have to do it before the. You have to do it. Actually, we have to do it before the mothers start to get pregnant or something like that. So before the mothers to get the first pregnancy, so that if there's any Rh positive blood going into the mother's body, then the injected immunoglobulin will attack those Rh positive blood from the baby, and the mother's immune system will not have a chance to develop the immunity. So that's the whole basis of it. Let me repeat this. So before the couple plan to get pregnant, the doctor will give this injection to the mother, so that after the woman gets pregnant, then if the part of the Rh positive blood from the baby go through the placenta into the mother's baby, into the mother's blood, then the injected antibody, this one anti-Rh immunoglobulin, will attack the baby blood in the mother body, so that mother's immune system will not have a chance to develop the active immunity. And in the subsequent pregnancy, the mother will still have to be given of this injection. So every time the mother gets pregnant, they will have to get this injection, so that it will prevent the mother to develop this kind of active immunity. And injection of this antibody is an example of the passive immunity as well. So this is what happened. The Rh positive blood cell from the baby can go through the placenta to go into the mother's blood. Mother's blood, it has no Rh factor. Because of that, the mother will start to make antibody against those Rh positive cells. And the first pregnancy is fine because of the graph. The first time the mother will produce a low level of antibody. That may or may not cross the placenta. Even if it crosses the placenta, it won't cause too much damage to the baby because it is low level. But the next time when the mother gets pregnant, we will have a high level of this. High level of this will actually can kill the baby. Tissue rejection. So the last type, organs in the kidney and heart, we do a lot of kidney transplant or heart transplant nowadays. But we have this tissue rejection issue. The reason is that the MHC protein on the organ, they have different people will have different MHC protein. So this is the one that causes the issue. It is difficult to find the match between recipient and donor. That's why if we had a match in the organ donor and organ recipient, that will be the best case scenario. So, but most of the time we cannot find the good match. Then what will happen is that we'll give the immune suppressive drug to the organ recipient to take. Hopefully it will minimize the rejection. Xenotransplantation, it is something to do with biotechnology again. So we genetically engineer the pigs, special pigs, that they do not have MHC antigens. So when those pigs, they do not have MHC antigen, that means they are immunely neutral. They're neutral. They have a neutral immunity. That means the surface of the organ do not express any MHC. When the surface of the organ do not express any MHC, then the ultimate goal is that the pig organ can be used for any type of organ transplant, just like the type O blood patient. This is the ultimate goal, but of course it has a lot of issues. Autoimmune disease. Okay, this is the part that we focus on because a lot of human diseases are based on the autoimmune system malfunction. So the cytotoxic T cell or antibody attacks person self-body tissues. Myasthenia gravis. Myasthenia gravis. So it is a muscle weakness because our own immune system attack the neuromuscular junction. Neuromuscular junction is basically the nerve. Neuro means the nervous system, the nerve. Muscular, muscle. Junction, it is basically the part that our nerve making connection with the muscle. It is that particular area that the immune system attack. And then we have multiple sclerosis. Multiple sclerosis is basically the immune system attack on the myelin sheath. Remember in the nervous system lecture, I told you that myelin sheath, they are basically formed by the glial cell. So the immune system attack the glial cell that form the myelin sheath. Systemic lupus erythematosus. So it causes the immune system attack the kidney. Rheumatoid arthritis, I told you that the immune system attack the cartilage in the joint. Last but not least, immunodeficiency disease. So the immune system is unable to protect our body. AIDS is the most famous one we know. What happened in AIDS is that the HIV, human immunodeficient virus, HIV attack helper T cells. As I told you that helper T cells, they are like the skull. So when they attack helper T cells, then no one can detect infection. When no one can detect infection, no one will send the cytokine to tell the entire army to start attack. So that means even though you may have your immune system may be intact, but since you don't have any helper T cells, then no one will mobilize the entire army to defend you. Then you become immunodeficient. So people who get AIDS, they are usually not killed by the AIDS virus per se. They are usually killed by other infection. So we have primary or congenital immunodeficiency. They are born with the impaired or missing immune system. Some people are born like this. The SCID, severe combined immunodeficiency syndrome. So the antibody or cell-mediated immunity, they are lacking or inadequate. So the primary or congenital immunodeficiency, this is the example, the SCID instead of AIDS. So that's it for the immune system, lymphatic and immune system lecture. I will see you on Wednesday for the reproductive system.